Lighting up the way, Valley Electric Association.
And we expect to open the Pahrump HealthCare Partners, DaVita Medical Group, medical office building in the fall. Don't have a date pinned down exactly yet, but it'll probably be October as best we can tell.
It seems to be coming along. What are we looking forward to seeing there?
Well, it'll be a resource for the community. We have about 20 providers that are physicians, nurse practitioners, and PAs who work in Pahrump in our primary care offices in pediatrics. And so those individuals will be moved from the smaller offices where we have leases in town into this one large building. So we have imaging, we have laboratory testing, we have a pharmacy. We have a great relationship with Humana for our Medicare Advantage patients, and they have a center they call a guidance center that Humana members can come in and talk to the Humana representatives about issues with their coverage or their benefits, and a big meeting room we can use for people, and pods where we'll have 3 or 4 providers serving their patients in a very unique structure. The structure from our sake, we started doing this model just about 2 years ago, where we have these work units or pods where there's 3 or 4 providers and a bank of rooms. Patients come in one side of the room and the physicians come in the other sides. So it's laid out very nicely. Should be very, very effective.
That has been kind of a design technique that has been being used lately, and it seems to be more efficient. I know our VA clinic here as well is using that technique, where the patients can come directly and they don't have to wait in the waiting room very long. They can come right into the actual patient room.
Yeah, so it would have been thought of as revolutionary probably 10 years ago. And when I practiced internal medicine, when I was in practice in California for many years ago, the thought of that would have been no way we would do that, putting up a medical building. But this has clearly shown to be more efficient. We have 2 offices in Las Vegas. We did like this, more focused around seniors there in particular, and it's proven to be very effective. In addition to the primary care, we will have an expanded urgent care. We're now open for 12 hours a day, 7 days a week in our current location. And this will be open longer every day and be highly available for anybody and everybody to come in. Obviously the patients we've already been serving, but for anyone else in the community to provide access to them for care after hours.
Will it be 24 hours? Is that something that you might be looking at for that urgent care?
Not to start with. We're going to expand the 12 hours a bit and kind of get ourselves settled into the building and be sure we're capable of expanding it to 24. But we're probably going to go from 8 a.m. to midnight right after we open and get our legs underneath us. The 24-hour thing is not, we've talked about it, but it would be a year or 2 down the road probably.